This is Melinda Blazer, Director of Clinical Education at the Duke Physician Assistant Program. Today I'll be giving you an overview of the clinical year. The clinical year begins in July, following a summer break at the conclusion of the preclinical phase of training. Students will begin with the Bridge course, which is a 2-week-long course to transition students from their didactic to their clinical training. Our clinical rotation blocks will begin in late July and run one full calendar year, including 11 clinical rotations and 1 non-clinical rotation. 7 of these are required courses, which we'll review in just a moment. Students will also participate in 2 elective courses. And then you'll see here that students will also have an opportunity to do at least 1 rotation in a medically underserved area. And this was really developed out of the sort of mission of Dr. Stead, who developed our PA profession with a desire to improve access to care. And the Duke PA program still feels like that's a very important role for physician assistants and for students to experience over the course of their training. And it is something that we have maintained as a requirement within our curriculum. Students also are required to do a minimum of 2 rotations out of the Durham area to expand their experiences and their opportunities for practicing with diverse groups of patients and in diverse settings. Students will participate in the Duke graduation in May with an MHS degree conferral in September, and students complete the program a year after starting the clinical year with the senior seminar course in late July, with a program completion date typically in early August. This is a list of the required clinical courses. You can see that internal medicine and primary care are both 8 weeks in duration, comprised of 2 4-week blocks. Internal medicine is oftentimes done in 2 different clinical settings. Many students will do both an outpatient internal medicine and an inpatient internal medicine experience. All students will have a minimum of 4 weeks in the inpatient setting. Primary care experiences are working with family medicine providers in an outpatient clinical setting, and students are typically placed in the same site for an extended 8-week rotation. General surgery course involves opportunities to practice with general surgeons in the preoperative, intraoperative, and postoperative care settings. And emergency medicine takes place in the emergency medicine department, working with EM-trained physicians and APPs. Our pediatrics course, 4 weeks in duration, is based in the outpatient setting, doing primary care pediatrics, and women's health is also 4 weeks in duration, maybe in a variety of settings, but primarily in the outpatient setting where students have exposure to prenatal care and routine well-woman care. Labor and delivery may or may not be a component of women's health, depending on the site. Behavioral medicine is our final required course, and it is also 4 weeks in duration. We have a variety of behavioral medicine clinical sites, and students have an opportunity to practice and may be placed in a variety of different settings with opportunities to have exposure to a variety of different behavioral medicine conditions within those courses. And then we have the EvidenceBased Medicine 2 course, which is the non-clinical course during the clinical year, and it's 4 weeks in duration. It continues training learned during the Evidence-Based Practice 1 course in the preclinical year. Students have the opportunity to research a topic that is interesting to them and do a literature search and analyze that data, and then at the conclusion will present a presentation to their peers and a group of faculty, as well as create an abstract based on their research. Quality improvement content is also a significant component of this course, and students will be engaged in a quality improvement project during their 4 weeks. There's a variety of clinical electives available to students, and I think this is one of the real strengths of coming to a large academic medical center. Students have the opportunity to select 2 electives, both 4 weeks in duration. And our program is able to offer a variety of exciting electives, over 60 options and growing, from things that are common in terms of medical and surgical subspecialties like cardiology and orthopedics and hematology, oncology, to things that are unique and special to Duke, opportunities in genetics or clinical research or pediatric CT surgery, as well as a variety of medical, pediatric, and surgical subspecialties throughout the medical center. For those of you who are visual learners, this is an opportunity for you to see what sort of a snapshot of the entire clinical year looks like pictorially. You'll note that unlike the preclinical year where sequence of courses happens consistently for all students, in the clinical year we see students having courses in a variety of different orders. So this is just one example of what a student schedule may look like, but it will vary for all students depending on their individualized course schedule. Duke partners with the Duke PA program partners with the Duke Health System to administer about 45% of our clinical rotation sites, and then we have close affiliations with other hospital systems across the state and out of state to support ongoing high-quality student rotations. So the Duke Health System comprises the main Duke Hospital, as well as a Durham community hospital called Duke Regional Hospital, as well as the community hospital in Raleigh, Duke Raleigh Hospital. There's also numerous Duke clinics and a network of primary care clinics referred to as Duke Primary Care, in which our students spend time. We have close affiliations with the VA hospitals, both here in Durham as well as in the Asheville community, for which our students regularly spend time. And we have students who may have an opportunity to partner with or to experience rotations within the Wake Med Health System, which is a large private hospital in Raleigh. Students may have who express interest and or may have the opportunity to do rotations at Womack Army Medical Center, which is on Fort Bragg down in Fayetteville area. We also have close partnerships with Novant Health across the state of North Carolina and Centera Healthcare, which is located in the eastern part of the state and the southern parts of Virginia, so students may rotate there as well. We also have partnerships with some unique hospitals across the country, including St. Jude's Children's Research Hospital, Hurley Medical Center, and Norwalk Hospital. There are several out-of-state opportunities, and these do continue to grow and develop. Currently, Virginia is the only out-of-state location where students may be assigned to their clinical rotation sites. All of the other ones listed here, opportunities within Connecticut, Michigan, Tennessee, Montana, Oregon, New York, Florida, or Maryland, are opportunities for site-specific rotations where students may choose to opt in. And these are considered out of network, in which students would be required to provide their own housing and transportation for these experiences. These oftentimes reflect unique opportunities for students, such as the rotation in Memphis, Tennessee at the St. Jude's Children's Research Hospital, or the site in Oregon, which is at a Healthcare for the Homeless clinic, or the Maryland location, which is a newly developing clinical research elective at the National Institutes of Health. One of the really great things about Duke is that we partner not just with academic medical centers and hospitals across our state, but also with a variety of other practice settings, hospital-based clinics, community health centers, urgent care facilities, health departments. And I think one of the really rich benefits of this experience is that by the time a student is completed their training with our program, they've had an opportunity to practice in most of these settings. And so they have a sense of where they really belong in terms of a setting, which is, I think, oftentimes equally as important as identifying the specialty that is going to make them happy and have a high quality of life for them as a practicing clinician. We also offer global health electives here. We currently have 6 countries where students may have the opportunity to go for a global health elective. These rotations aim to provide students with valuable cultural and medical learning experiences in foreign settings. We do know that the availability of these clinical sites and the ability to accept students to them does vary from year to year. This is another experience where cost for travel and housing is at the student expense. However, students may submit educational related travel expenses for global health opportunities to the Office of the Registrar for an increased amount of student loan allotment to help support funding for this and students for whom that might be needed. We also have opportunities for limited students to participate in longitudinal primary care offerings. These are a small handful of clinics or communities across the state in which a student may elect to do a primary care, pediatrics, and in some cases women's health or behavioral medicine rotations, all within one community or all within one site, depending on the location. We review with students the availability and the opportunities for these, and then there is an application process for students who are interested, though it is important to be aware that there are a limited number of these spots each year. In terms of preparation for the clinical year, our team works hard to partner with students beginning in their preclinical phase of training to ensure that they are well prepared and eager to enter their clinical phase of training. We'll provide introductory informational sessions in November and of the preclinical year, and then in January students will meet with their clinical coordinator. So students will maintain their faculty advisor throughout both years of the program, but they will also be assigned a designated clinical coordinator in the second year of the program, and that's really your person who you want to share what your interests are, your learning needs and preferences, and that's sort of your go-to person to help support your clinical phase of training. Our team will work really hard to support students in their overall structure and learning throughout the clinical phase of their training, as well as in preparation for it. We ask that students submit preferences, which includes applications to global health or the longitudinal primary care rotations, as well as submission of their elective requests at the end of January. And then our team diligently works to create a large clinical schedule, which is typically released with preliminary schedules in April and May. No matter where you attend PA school, you will learn the importance of flexibility in the clinical phase of training. Our program, as all programs, relies heavily on preceptors and across the country to support the ongoing supervised clinical practice of PA students in the clinical phase of training. And we know that sometimes unexpected things happen and rotations may get canceled. So we do stress that these are preliminary schedules. Our hope is that they remain intact, but we do know that at some point they will have to change for some students, and we appreciate students' flexibility in that. And as I mentioned previously, the clinical year starts in mid-July and it will finish in late July of the subsequent year. So the transitional course that we talked about, Bridge the Path to Patient Care, is 2 weeks in duration, and it is really focused on skills-based, case-based learning and review to prepare students to enter the clinical environment. Students will participate in advanced cardiac life support training during this time, as well as training for electronic health records and other sort of onboarding of training modules for the clinical setting. And then students will participate in the SAPA oath ceremony to conclude the transitional phase of their journey. Evaluation in the clinical year looks slightly different than in the preclinical year, so I want to take a few moments and discuss that. Given the limited exposure that PA students have to clinical training and the condensed nature of our training, we do have required attendance in the clinical phase of the program, and students customarily will work the same hours of as their preceptors, and so that oftentimes means that on outpatient rotations that's more of an 8 to 5 type of thing, and on inpatient rotations or rotations within the hospital setting that may be longer hours, and so that's sort of our expectation within the allotted duty hours, which we review with students in advance. Students do have discretionary days over the course of the clinical year, which they can request for personal time, things like weddings or travel or interviews for jobs, and there's a process that outlines that. Clinical courses are evaluated based on preceptor evaluation, and for required clinical courses, an end of rotation exam. There may also be written assignments or as part of those courses, and then all students are required to log their clinical encounters throughout the clinical year, and that is also part of the breakdown for clinical evaluation. Students also are required to have a verification of clinical competency for the core courses, and that is outlined for students and preceptors as they prepare for their transition into the clinical year. The evidence-based practice 2 course is evaluated through the presentation and abstract, as we talked about earlier, as well as the quality improvement project. And then there are 2 large practical examinations or clinical examinations during the second year, and that is the clinical skill problems exam, which occurs about just over halfway through the clinical year, as well as 2 summative assessments. One is a clinical summative exam, which we call the CPX exam, and the other is a written summative assessment, and those occur within 90 days of the completion of training. As I mentioned, logging of all clinical encounters is a requirement in the clinical phase of training. Our students utilize a web-based system to do this, and what that means is that they can access it from any device that has internet access, and they log this in a de-identified manner. This allows both the student and the program to have a better assessment of what learning activities and what patient encounters and exposures the student is having in the clinical training environment. We find that we use this as a program for evaluation of student progression, as well as evaluation of clinical sites and program accreditation standards. And students oftentimes will need this for credentialing after they graduate. So more and more frequently now, we're finding that students need to access this data in order to support credentialing and onboarding to their initial jobs. As I mentioned, students do participate in at least a minimum of 2 rotations, which are out of town, and we define that as at least 50 miles or greater from the Duke PA program. When students are assigned to out-of-town housing, with the exception of out-of-network sites, DPAP, so the Duke PA program, will support both funding and logistical planning for student housing, and we do that through a variety of mechanisms. Typically, most students on out-of-town housing are placed within what we call the AHEC housing, which is the Area Health Education Centers of North Carolina, which are a very close partner and supporter of our clinical training programs here. We also maintain 2 apartments, one in the Asheville area and currently one in the Williamsburg area for students. There is also support from the program for travel reimbursement up to a specified amount. We do require, because of the amount of travel, both potentially to distant locations within the clinical year and for regular travel to and from clinical sites each day, that students do have dependable transportation, which means that we do require students to have access to a vehicle during the clinical phase of training. As I mentioned previously, support, funding, and logistical support for housing applies only to in-network sites. So if students are interested in one of the out-of-network sites that I spoke about earlier, or proposing an independent study, which I'll talk about in just a moment, then travel and housing is at the student expense and is up to them to coordinate. So independent studies are opportunities for students to propose elective rotations, which are currently not established within the Duke Health system. This does require an application process and approval by the program director and clinical team, and as I mentioned, travel and housing is at the student expense. We do request that these submissions for independent studies be for compelling educational reasons, and that the preceptor or site that is identified is both willing to host the student and that they are willing to support future Duke students. There's a lot of effort behind the scenes that goes into developing these sites, and we like to be able to pay it forward to future classes. That is how we've been able to grow our list of really exciting and interesting out-of-network sites that our current students have the opportunity to participate in, is by is through this ongoing commitment from independent studies. So students also will have the opportunity to return to the clinic, to return to DPAP throughout the clinical year for what we call callback days. And this is an opportunity that occurs at the end of some rotations, not all, but students come back to the program for a 1 to 2 day sort of educational opportunities, and this will include sort of didactic presentations, professional development opportunities. This is oftentimes time for assessment, so we do end of rotation exams on these days. We may also do some of our other clinical assessments that we talked about. There's also opportunities for small group sessions and discussions around things like cultural competency and health literacy and things of that nature, and an opportunity to start planning for post-graduation events. So there's typically opportunities for residency and fellowship fairs to learn more about that. We host a job fair as part of these days. So really over the course of the clinical year, our goal is not only to support students academically, but also to really adequately prepare them professionally for transition into their future roles as PAs. As I mentioned, Duke hosts their graduation in May, and we do have a large celebration where we invite family and friends to come and honor the hard commitment that our students have worked so hard for. It's a really special event and one that I think is really cherished by our students and our faculty alike. It does occur in May, as our program does not complete until August. Students have their degrees conferred in September and their certificate of completion at the end of August when the program completes. However, this is an opportunity to celebrate with the larger Duke community and the DPAP family and your family and friends as well. The clinical year concludes with the senior seminar course. It is comprised of a board review course, which is produced by the faculty here, and is also an opportunity for students to meet with advisors and have their exit interviews and talk about their portfolios that they've created over the course of their 2 years. And this course concludes with the certificate of completion ceremony, and it's that certificate of completion that allows students to sit for their PANCE. So to summarize our clinical year, as I mentioned, it is a full year. It includes 10 rotations, which is comprised of 2 electives and 7 required courses. Students typically will have greater than 2,000 hours of direct patient care experience by the conclusion of their clinical year. We also have a full month dedicated to the Evidence-Based Practice 2 course, so students can have some kind of dedicated brain space to think and to work on that while not being distracted by other clinical requirements. Students, I think, really benefit from an opportunity to practice and experience a diverse group of healthcare environments, both in terms of setting, inpatient and outpatient, as well as communities, so within the Durham community and within communities across the state and perhaps in other states, so that they really have a good sense of what they're looking for in their first job and where they feel most comfortable, as well as sort of having a really strong foundational educational background as well. We believe strongly that your goal in the clinical year is to focus on learning and patient care, and that our job is to manage the logistics and the housing. And so we take care of that for all of our in-network rotations. Students remain connected to their faculty advisors, their clinical coordinators, and our community at large throughout the clinical year through callback days and email communication. And we work really hard to empower students to transition effectively into their professional roles. We ensure verification of clinical competence through a variety of ongoing exams, practical evaluations, and clinical evaluations throughout the year. And we hear from our graduates that they feel well prepared to enter the workforce. We have just some employment data for you, as that's sort of the end point of our journey for students as they conclude their training here. Consistent with our mission, we're happy to see that about a third of our class ends up in primary care, and about a quarter of those are practicing in federally designated underserved areas. In the class of 2017, just over 20% ended up in surgery or surgical subspecialties and 10% in emergency medicine. And a large percentage of our students ended up taking jobs in internal medicine or medical subspecialty practices. That concludes our talk, and we will look forward to seeing you here at Duke for your interview day and answering any additional questions that you might have about the clinical phase of training. Thank you.